Morning, friends, patients. We here at the lab this morning, Mr. Lochan here at Medical Scientific, and I just came across a very interesting thing here. We see it quite regularly, but because of the amount we have this morning, I wanted to show you something with respect to antibiotics and common use of antibiotics, some common antibiotics. Very interesting occurrence, and this is just a little cautionary note for persons who are using antibiotics to be mindful that not all antibiotics will work for your infection. So what we have here is a sample of urine from a patient, and there's a laboratory test called a microculture and sensitivity, where we take a specimen from a patient, whether it's a urine, a swab, pus, sputum, whatever, and we inoculate it onto agar plates, and those agar plates will grow that organism if it is there. And when that organism grows, we want to do what is called a sensitivity test. One of the common ways of doing a sensitivity test is really to expose the organism to antibiotics. And I've got a few in front of me here this morning, and I want to just briefly explain to you what the sensitivity test does. Basically, we inoculate this large plate with organisms from the patient, and then we subject those organisms to a list or a panel of antibiotics. So each one of those circles here are antibiotics: cefepime, cotrimoxazole, nitrofurantoin, piperacillin, tazobactam, ciprofloxacin, etc., etc. What you are seeing on this plate, the clear zones are zones of inhibition, meaning that antibiotic prevented the organism from growing. So that is what we will tell the doctor to use. In a report, we will say, Doc, okay, sensitive cefepime, sensitive ceftazidime, cefepime sensitive to nalidixic acid, but not these that are resistant. This will be listed as resistant. But this is not the message this morning. I'm sure most of us will be familiar or have heard antibiotics names such as cotrimoxazole, or what is commonly called Septra, also Augmentin and ciprofloxacin. These are three antibiotics that are commonly used in the medical industry and dispersed to patients at the pharmaceutical level. And these antibiotics are Septra, Augmentin, and ciprofloxacin. And I just want to show you the incidence here of organisms that are resistant to these three antibiotics. In this patient, we've got resistant to Augmentin because it's a very small zone. We've got also resistant to Septra, but this one is resistant to ciprofloxacin. So you have 2 out of the 3 commonly used antibiotics here resistant. Organism is resistant. Then also for this patient, we've got ciprofloxacin with a very small zone, we've got Augmentin, and we've got sensitive to gentamicin. All right, 2 out of 3 again. In this patient, we've got resistant to Septra, resistant to ciprofloxacin, and resistant to Augmentin, right? These names are commonly used in the medical industry and diagnostic support for patients. This patient as well, resistant to cotrimoxazole, one of the organisms here, there was a mixed organism unfortunately, resistant to cotrimoxazole or Septra, resistant to ciprofloxacin, and resistant to Augmentin. That is a 4th patient with a significant urinary tract infection. Here we've got resistant to Augmentin, resistant to ciprofloxacin again, and resistant to Septra. In our 6th patient here this morning, resistant to Septra, sensitive to ciprofloxacin, and resistant to Augmentin. I share this with you because it is imperative in the presence of a significant infection that antibiotics are issued to the patients that are gonna work and gonna work in vitro. In vitro is through a diagnostic test, and when the diagnostic test shows that the antibiotics are sensitive or resistant in vitro, it is assumed that upon giving the patient these antibiotics, it will work in vivo, which is in life, in the patient's body. This is a very, very sobering thing this morning to indicate that the wanton, uncontrolled use of antibiotics by patients is not the proper thing to do, for many reasons, because that augmentin, that ciprofloxacin, and that gentamicin may not work, and you may have to use other antibiotics. So we encourage you to liaise with your physician, get guidance from them properly, and also to engage and respect the laboratory diagnostic test called a MCNS, microculture and sensitivity, that not only identifies a pathogenic or a disease-causing organism, it tells us which antibiotics can work for that patient. And different patients can have the same organism. It does not mean that the same antibiotic will work for them. This is us at Medical Scientific expressing a little bit of compassion this morning and a little bit of love in terms of sharing information to the people, to our patients, and to the general public, and especially